Good day, I am Genalyn Romualdo from BSN 3D and I am here to perform the skill intravenous insertion. Let's proceed. For the first step, check the physician's order and gather all the equipments and supplies needed. Check the physician's order to ensure that you are giving the right treatment to the right patient via the right route of administration to avoid clinical errors. For the equipments and supplies, gather IV fluid, short arm boards, IV stand, tourniquet, scissors, administration set, needle or catheter, and surgical tape. And then introduce yourself to the patient and explain what procedure to be done and why. This is to build rapport and to inform the patient to reduce his anxiety. Hello sir, I am Genalyn Romualdo, your nurse for today, and I am here to administer you IV fluid to treat your dehydration. This is necessary to bring back your electrolyte and blood glucose at its normal level. Is it okay with you, sir? Okay, that's good, sir. The second step is to perform hand hygiene, following infection control measures, to prevent infection and ensure that no microorganisms will introduce to the patient, and then verify client's identity to ensure that you are giving the right treatment to the right patient, and lastly, assess for allergies to prevent any allergic reactions and for the safety of the patient. May I know your name, sir? When is your birthday? Okay, do you have any types of allergy? Okay, that's good, sir. The third step is to prepare the client. Assist the client to a comfortable position, either sitting or lying. Expose the limb to be used, but provide client's privacy. The windows and doors are closed, and I am going to put the client's limb to the table. Next procedure is to prepare the equipment. Prime the IV tubing to prevent air bubbles into the IV line and avoid air embolism to the patient.
Was it the voice? Was it the fire burning in me? All of the noise turned into choirs of harmony. Left me with the pieces of forever that you broke. But since you left me low, I've been high.
After priming IV tubing, select venipuncture site. Use client's non-dominant arm and identify possible venipuncture sites by looking for the veins that are relatively straight. Check agency protocol about shaving if site is very hairy. Next step is to dilate the vein. Place extremity in a dependent position. And then apply tourniquet firmly 6 to 8 inches above venipuncture site. Explain that tourniquet may feel tight. Do not place too tight and do not leave it for more than 1 minute. For elders, place arm in a dependent position and do not use tourniquet because their veins are already exposed. Sir, I will now apply the tourniquet to you to promote dilation of your vein, although this may feel a little tight. And then apply clean gloves to observe sanitary measures and clean venipuncture site to prevent infection. And then clean skin at site of entry with a topical antiseptic swab. Use a back and forth motion for a minimum of 30 seconds to scrub the insertion site and surrounding area. And then, permit solution to dry on skin. For the next step, insert the catheter and initiate the infusion. Remove catheter assembly from sterile packaging. Use non-dominant hand to pull the skin taut below entry site. Hold the over-the-needle catheter at 15 to 30 degree angle with needle bevel up. Insert catheter through skin and into the vein. Once blood appeared in the lumen of the needle, lower the angle of the catheter until it almost parallel in the skin, and advance the needle and catheter approximately 1/4 inches further. Hold needle assembly steady. Advance the catheter until the hub was at the venipuncture site. Put pressure on vein proximal to catheter to eliminate or reduce blood oozing out of catheter. Stabilize hub with thumb and index finger of non-dominant hand. Carefully remove stylet. Engage needle safety device and connect distal end of extension set tubing to the hub. Next step is to dress and label venipuncture site and tubing according to agency policy. Label dressing with date and time of insertion, type, gauge of catheter, and nurse's initials. Discard and remove tourniquet, remove and discard gloves. For the discontinuation of IV catheter, stop fluids infusion and disconnect IV extension set from the IV tubing. Pull skin taut while removing dressing. Remove IV catheter and inspect the tip for integrity while applying pressure. And then dispose catheter appropriately. And lastly, document data, assessment data, and client's response. This is important as this is a legal basis and to ensure the continuity of care. That's all for today. Thank you.